Okay. Okay, no, I thought my voice was strong enough. But yeah, ladies and gentlemen, I think we can start. I hope everyone is ready. Our colleagues from the broadcasting media. Okay, we're ready. Okay, let me welcome you to this important media briefing this evening. We thank you very much for making time to come here. We really appreciate that you could be here. The National Council of Provinces Chairperson, Mayor Tandimodise, invited you to this important media briefing this afternoon, this evening, in order to communicate the program of Parliament's most important flagship program, which is taking Parliament to the people, which will be beginning here in the Free State tomorrow until Friday. So without any waste of time, we are going to, she's not alone, she's accompanied by the leaders here from the executive, from the provincial legislature, as well as from the National Council of Provinces. She will be leading this media briefing for the statement that she's going to be presenting. And on her left is the hosting speaker of the Free State Provincial Legislature, Honorable Mangaung. And on her left, not ultra left, extreme left, is the ABC for Health, Honorable Butana Kumbel. And on the right of the chairperson is the Chief Whip of the National Council of Provinces, Honorable Season High. And on the right, extreme right of the Chief Whip is Honorable Lydia Moshodi, who is the permanent delegate from Free State in the National Council of Provinces. So I'm going to just quickly to ask that you put all your mobile devices on side as I call the chairperson of the National Council of Provinces, Mayor Tandimodise, to present the statement, and thereafter we will take questions.
The Program Director, the Speaker of the Provincial Legislature, Ndade Kompela, MEC for Health, Chief Whip, all the media houses present here today, ladies and gentlemen. The program for 2016, Taking Parliament to People, takes place under the theme of celebrating 20 years of the Constitution and 20 years since the establishment of the National Council of Provinces, deepening parliamentary oversight for delivery of quality services to our people. This will take place at the Kaiserslautern Stadium, starting from the 21st to the 25th of August. This follows our visit to Harib on the 15th to the 19th of May 2017. Ladies and gentlemen, the theme is apt in that we are celebrating 20 years of the Constitution. It is also apt because the NCOP turns 20 years. It is apt because our Constitution says that we must ensure and deepen participatory and representative democracy. As we did in Harib we shall continue here at Mangaung City Metro to focus on the health delivery and related services to the people, as well as the maintenance of the facilities in the province. We all know that health is the main priority of government. Improving the quality of public health care and increasing life expectancy is one of the objectives of the National Development Plan. The NDP envisages the NHI, the National Health Insurance, as key to achieving equity, efficiency, effectiveness, and quality of health care provision, universal health coverage, and a significant reduction in the risk posed by social determinants of diseases, as well as adverse ecological factors. Agenda 2063 also envisages Africa, where African people have a high standard of living and quality of life, sound health, and well-being. The Sustainable Development Goals seek to achieve similar objectives of good health and well-being. As a legislative body, we have the responsibility to oversee the realization of these objectives by the executive and to ensure that our people, the people that we represent, have access to quality health care. Ladies and gentlemen, during our pre-visits to Harib and during the research period which we conducted in the Mangaung City Metro, we discovered that water supply to health and education facilities, sanitation, patient transport, staff shortage, and aging infrastructure are some of the major challenges facing the provision of health care to the people. We, as members of the NCOP, had first-hand experiences of the challenges that healthcare facilities are faced with in the province. We witnessed nurses and caregivers fetching water with buckets in order to flush toilets. We witnessed nurses not washing their hands before patients due to the shortage of water. We realized that uninterrupted supply of water is a necessity for the quality delivery of health services. We also noticed that no health or education facility can actually operate without water. We also want to say that we acknowledge that government develops infrastructure. That in most instances, departments and government entities do not budget for maintenance of infrastructure. That is a fact. We must say that if they do, the budget is sometimes diverted to other compensations, either compensations of employees or other activities. And the result is that maintenance is not done, infrastructure collapses. This is the state that most of our health facilities find themselves in. It is therefore necessary to maintain the effective oversight over the executive to ensure that there is both delivery of quality services and proper maintenance of the facilities meant for such delivery of services. In our quest to ensure delivery of quality services, we have already met with the relevant national and provincial departments in an attempt to address this dire situation. We have also met with Bloom Water, an entity responsible for the water supply in the Harib and Mangaung City Metro. We expect them to respond to these issues during the course of this week. From the 21st to the 24th of August, we shall hold public hearings at the Kansas Football Stadium, where members of the public will have an opportunity to raise issues on health and any other matter that they may wish to bring to our attention. The public hearings on Mondays and Tuesdays will focus on health. The Minister of Health, the Honorable Mutwaledi, who we are expecting on Tuesday, will be around. The Honorable MEC for Health in Tate Kompela have also confirmed their attendance. Since we will also focus on health facilities in correctional services, the Minister for Correctional Services, the Honorable Masuta, will be available, we are hoping, tomorrow. The ministers and MECs will respond to issues which will be raised by the public. On Wednesday, the focus will be on the economic development. The MEC is responsible for economic development, has confirmed attendance. Unfortunately, due to the cabinet meetings, the ministers responsible for trade and industry and economic development, although they had promised to come, are unable to attend. On Thursday, we will dedicate it to local government, to water and to sanitation, to finance and to education. The ministers and MECs responsible for these portfolios have all confirmed attendance. The intention of this public hearings is to consider the provision of water and sanitation to health and education facilities, the maintenance of infrastructure, and how these may be financed. Public hearings will also deal with the support that the national and provincial governments provide to local government to enable it to carry out its obligations as required by Section 154 of the Constitution. Parallel to the public hearings will be the oversight visits to health facilities in the Mangaung Metro. This will include the clinics, hospitals, and the facilities in the correctional services. In both public hearings and oversight visits, members of the National Council of Provinces will be joined by members of the provincial legislatures and councillors. In other words, we are expecting other members from other provinces who are willing and able to join us starting from tonight throughout the week. The program will culminate with the address by the Deputy President to the House on the 25th of August, 2017. This will be a formal sitting of the House, and on an annual the English. We know that the NCOP annually has this take in Parliament to the people, and that there is a rotation between the President and the Deputy President. You'll recall that last year when we were in the Eastern Cape, it was the turn of the President to address the NCOP. This year, it is the turn of the Deputy President to address us. So we will this year be having the Deputy President. We expect him to actually touch on the issues which will be raised by the public. So throughout the week, we will be sensitizing not only the Deputy President, but all the other executive members, so that when they do come, and if they so wish, they can be accommodated on the speaker's list to deal with the issues as raised by the communities. That will then conclude our week. The committees of the provincial legislature and the National Council of Provinces will, however, continue to follow up on the matters which will be raised during this week. We will also have a report back session in 2018. In other words, we have a pre-visit, we then come in, taking Parliament to the people. We then give the executive a chance, almost a year, to deal with all the other issues which they may not have been able to deal with. And then we come back to the communities. When we come back to the communities, it is to now respond directly at the issues which they had raised with us. It is not to go for new issues. We then just go back to the issues which were raised in the formal meetings to say, this is what we said, this is what the executive has said, this is what we have found has happened, this is what is still outstanding. And all the portfolio committees and select committees in whatever province continue to do that. So this program actually gives effect to the mandate of the NCOP as the melting pot of cooperative governance and intergovernmental relations. And ladies and gentlemen, I thank you.
Thank you very much, Honorable Chair. Ladies and gentlemen, the statement is copies of the statement are being distributed. We know that we are very privileged and honored to have members of the communication department of various departments and the councils, the legislature, etc. But we will appreciate if we can prioritize with those few copies the members of the press, and we have your email addresses. Immediately after this media briefing, email you the statement so that you can have it. But for these few copies, we'll appreciate it. We can only give to the press. And the statement was quite comprehensive. You could hear that this is Parliament oversight in action. Thank you very much, Honorable Chairperson. As I've said, you know, on the panel you've got leaders representing the executive, the provincial, legislature, as well as the National Council of Provinces, very ready to deal with whatever question that you would like to pose, any clarity-seeking questions. I'm opening the floor. There is a roving mic here. So, any question from the floor? So it was crystal clear. Okay. Oh, there's a question mark. You must ask a question, not a question. Just introduce yourself and shoot.
Okay. Good afternoon, everyone. My name is Kotazo from Mangaung issue. I'm going to direct my question to the chairperson, Mayor Memodise. Memodise, I hear you identified, I think, about 3 main challenges that you came across previously when you were here, and the thing of the issue of staff shortages in the hospitals or clinics is the main one, and I'm talking about this because we've seen a lot of graduates, nurses, commonly marching around, and some of them, they even stop at the street corners with their cards, jobless, professional nurse, whatsoever. Is there anything that's going to be done?
Should I respond?
Yeah, you can respond, Honorable Chair.
Yeah, we picked up on that. We have taken the matter to the Minister. We are also aware that we must enable both the Minister and the MEC the chance to themselves as the executive to consider and deal with the measures. We are hoping that they will find the resources, because ultimately it comes down to resources, and it comes down to the priorities of any government. In a recession, what do you prioritize? In an economy that is not growing, what must come first? We identified the issue of staff shortage, we identified maintenance. We also know that as a country, not as a president, as a country, the whole issue of budgeting for maintenance is problematic. And therefore we are hoping that we will start to push as South Africa towards an instance where it will be compulsory to have a budget identified annually which deals directly with maintenance. So yes, we've got undergraduates, yes, there are vacancies, but there is also an issue that I don't know if Ndate Kombela you want to respond to it, the reality of resources. So I think you should, but we do want to give quality, and therefore, as Ndate Kombela also gets into that, you will also remember that South Africa has been trying to move towards NHI. Now, there is a whole rethinking around that area, because you actually want to put more emphasis on preventing rather than curative. But I think in Data Kompela, if you can.
Thank you, Chair. Lord Chair, you spoke like the Minister of Health. Thank you very much. The issue of the shortage of personnel was raised by the NCOP when they were here. And Chairperson, immediately after you left, I have attended that matter vigorously. I think we'll show to the media from that time up until now what we have done. On nurses, and on doctors, on cleaners, we've done a little bit of work. We have identified weaknesses in the Department of Health that can make the Department of Health to make or break. One of those things is human resource, HR. If you don't have the soldiers on the ground, then you are going to have a problem. The second thing that the Chair spoke about is an issue of infrastructure maintenance. I was responding to questions in the legislature Metandi two days ago about the infrastructure at the National Hospital, infrastructure at other hospitals, Orange and all that. Those hospitals were built in 1961. And at that time, the hospitals were built only for white people in Bloemfontein. It was not open for the majority of the people who are, Bloemfontein is the second largest, if not the first largest on population. Now that infrastructure can't take that bunch, but it is true. The appetite for infrastructure was not that very good. And we have turned around on infrastructure. We have, media will see as we move to different hospitals, not all of them, that re-khutlisitse dintho tsa letsapao tsa bontate ba ne le workshop attached to the hospital. Ha bulb e shwele, ha una tender ya bulb. Ha would be able to do that, and they are doing that. Ha crash ya motho e robile, ha o lo reka tender for ulugise di crash then. There are people ha le bill la bethe le tswile, ha o lo e lahla kapa o tle tender for kenya le bill. So we're beginning to turn around the situation around artisan le hore re etse dintho in the indoor, and I'm sure in no time re tla be le khona hore re win that battle. But we're checking Metandi, how work at NHI, we're changing the game. Unfortunately, professional nurses are going to be disappointed. We are now concentrating on the foot soldiers, people that are doing work on the ground. The professional nurses are high level there, and the people that have to do the work are staff nurses and auxiliary nurses, foot soldiers on the ground. And we are populating our personnel for now with foot soldiers on the ground by some civilians, not those who are monitoring and signing over a document. Because we have benchmark with the private hospitals. Private hospitals, finally, what is the 5? There is 1 professional nurse there, and 20 nurses, staff nurses, auxiliary nurses, those who are doing the work. And this one, who's 5, who's 1 running 5 wards, it's just for him to monitor and to sign and give a report as the doctors arrive. And we are doing that. We have started in Kharib. You can go there. In Transberg, you will not get everybody with epaulets there. You'll get everybody with no epaulets, but hard-working soldiers on the ground. So we are teaming around now. The troopers on the ground are going to work, and the generals will be very few.
Thank you, Honorable MEC. Is there any further input from the table? It was very important that the MEC emphasizes and make those points, because as you have heard the Honorable Chair say, the focus of this year's taking Parliament is health. So it's quite critical. Any further seeking question from members of the media? Okay, there is one. Just introduce yourself and show.
Good evening. My name is Tobias. I'm from CTFM. Honorable MEC Botana Kupela. I know infrastructure is a big concern in the communities, especially when it comes to clinics. Now I'm from a township called Heidedal. There was 3 clinics in that neighborhood. 2 vanished overnight. Yeah. And the funny thing is, the one is just in front of Pilinomi Hospital. Was there any, is there a reason for that? Or any clarity on that one?
No, thank you very much for hitting that. I think if you can be aware, you see that we're having some security there in Hededal just to protect these little remains that are there in Hededal. Hededal Clinic was crashed in terms of the World Health Organization standard, where there was serious threat on infection. But unfortunately, it was not attended immediately, and then people were taken out there because we're saving them from the infection. And that took long, and vandalism cropped in, and the whole clinic collapses. It's a big clinic, which was helping the Hededal people there. And then I think we're turning around that. Unfortunately, the most sad thing, issues of the clinic maternity, especially on capital, are done by Public Works. Then we must answer issues of Public Works, because Public Works was supposed to have get in quickly there, do that clinic if they have, because it's capital project. But if it's on maintenance and refurbishment and any other matter, I think that one becomes a matter of us direct as a Department of Health. But we are not outsourcing that responsibility, because inconvenience in Hededa of people who are getting into the hospital for their clinic, it's as good as they must go to the hospital, because they're using the clinic in the hospital. But I'm sure in no time, you will see probably in the next financial year or even before that, you'll see there's a little bit of a movement there. If we had an appetite to deal with a threat of infection there, we could have saved that hospital. But that is the only thing that has been. It was not removed by any malice or anything. It was just said it is not safe for people. It's going to cause problems. It's better to be close, remove people there. And we have removed people there for a long time. And people get in there and take whatever they want to take.
Thank you very much, Honorable ABC. And I believe that there's no further question, because the last question I know that I forced it to you. So I don't want to cause another pressure, I believe. But let me just in conclusion thank you, Honorable Chair. Thank you as well, the Honorable Speaker of the province. Honorable MEC, thank you very much. Honorable Chief Whip of the NCOP and Honorable Permanent Member of the NCOP, thank you very much. We thank also the members of the communication of various departments who have made this media briefing a success, thorough coordination. Thank you very much. We thank you, the members of the media, for making it this evening. Remember that as we have sent you the program for the whole week, we are going to be reminding you on a daily basis and updating it. We would really encourage you to attend and cover each and every day of the program. And also to say that you know, the leadership here, led by the Honorable Chairperson, because you have come in great numbers and they love you, they are inviting you to join them as they have lunch. Dinner. Dinner. Yeah. At the hotel restaurant. So don't just run away. There is a dinner that is prepared for you at the hotel restaurant. And thank you very much. Good evening.
Communicators, after the dinner, communicators must come and converge here. We are meeting here for communicators after the dinner.